I'm very excited to have some incredible facts and figures for us to be going over again, some incredible guest speakers, and we'll go ahead and get started. So just a quick introduction to the National Down Syndrome Society. Our mission is to empower individuals with Down syndrome and their families by driving policy change, providing resources, engaging with local communities, and shifting public perceptions. I will share too that the National Down Syndrome Society was founded in 1979. We are celebrating our 45th anniversary this year, and we thank you all so much for your support. I know many of you have connected with our organization in different areas of our community and have been celebrating with us throughout this year, so please stay tuned. We have a few more things in line for this incredible celebration for our organization. And I will say too, one of the greatest ways that we get to serve our community is through sort of these three core program buckets, one being resources and support, the other advocacy and policy, and finally community engagement. So some of you are familiar with some of the work that we've done in these different areas, and happy to elaborate a little bit more on those. So within the resources and support space, we like to share that we have a 1-800 helpline and an info box email to really field questions at any time of day and any time throughout the year to be able to help individuals with Down syndrome, their families, professionals, whether it be in the healthcare space or education or even in the policy sector, to really connect information that is up to date and current accurate information about individuals with Down syndrome. We really do share information from birth to end of life, everything from our prenatal guide to our end of life guide, and really anything in between, again, touching on the topics of financial wellness, education and inclusive practices, to even some of the latest research on issues like Down syndrome regression disorder. And we cover this through a series of, several different program areas, again, education, employment, health, wellness, aging, caregiving, and more. Within the advocacy and policy space, we have been known for many years to be a leader in this area. Some of you may remember our Buddy Walk on Washington, which is now known as our Down Syndrome Advocacy Conference, which takes place in the spring and is really an opportunity for us to engage with federal lawmakers. The United States Congress, members of the House and Senate, get to meet a number of individuals from the Down syndrome community as we educate and advocate for our policy priorities at that federal level each year. We also have a number of initiatives that we're working on and monitoring at the state level, everything from sub-minimum wage practices to organ transplant discrimination. We even have some incredible local advocacy efforts and grassroots efforts. Something like our Down syndrome ambassadors, or IDEAS ambassador program, is a great way for families and individuals to get plugged in, learning about the issues and really ways, tools, and techniques to advocate for change within their local communities. NDSS has been a leader in some incredible landmark legislation for the greater disability community, including the Achieving Better Life Enhancement Act, and some of the other policies that we've been really advocating for over the years. And finally, within our core program offering, community engagement. So this might be one of my personal favorites. This is when we get to really interact with individuals with Down syndrome and their families from all over the United States and even other parts of the world through some of our community initiatives. Again, I mentioned the Buddy Walk. This has been a program that we've started an initiative back in the mid-1990s and celebrating our 30th anniversary actually of Buddy Walks, something you may be familiar with in your local communities, especially during the month of October, which we claim as Down Syndrome Awareness Month, is when we have a lot of these advocacy opportunities for families and stakeholders around the country to engage in an awareness walk to really raise more awareness and education around Down syndrome. We also do our Times Square video presentation, which really kicks off the Buddy Walk season. It takes place every September in Times Square. We take our participants, thousands of individuals with Down syndrome and their families, up to Central Park to really kick off that awareness walk for the rest of the country. We also have a number of opportunities for individuals to get out and engage with our community through virtual racing and World Down Syndrome Day. Many of you may be familiar with 321. So Down syndrome being characterized by the third copy of the 21st chromosome. March 21st, or 321, is a very special, significant day for our community. Again, World Down Syndrome Day. We would encourage you all to celebrate with us, maybe rock some crazy socks, and take a look at our socials and follow along so that you can find ways to engage with us there as well. We have an incredible event coming up, one that I'm very proud to welcome the team at HSRI to as well. We'll have an incredible panel and a number of ways that they will be sharing information at this in-person event in Costa Mesa, California, taking place in just a few weeks, November 14th through the 16th. We'll have a number of topics, again, ranging from health, finance, research, advocacy, education, employment, and self-advocacy. There are two tracks. One is really tailored toward more of a general attendee, caregivers, professionals, the other being our modified track, which is really tailored a little bit more toward individuals with Down syndrome or folks who would like to engage in the content of this conference in a maybe more modified way with more engaging and hands-on opportunities. So we would encourage you all to take a look at this conference, get your tickets, and follow along as we lead up to this incredible event. We also have our Down Syndrome Advocacy Conference, which I mentioned, formerly known as the Buddy Walk on Washington, taking place in 2025, April 28th through the 30th. This will be in Washington, D.C., and we'll be staying again at the Renaissance Arlington Capitol View Hotel. Feel free to follow the link. And again, these slides will be available in PDF form. The links will be live. So if you want to check this out later and follow those links to register for the Down Syndrome Advocacy Conference, we would love to see you all there. Again, this is an opportunity for folks to really engage with the policy priorities that we find to be significant to the Down syndrome community and in many ways the greater disability community, and would welcome you all to join us there. Finally, it is my esteemed pleasure to introduce you to Lindsay DuBois and Laura Vegas, both from the Human Services Lindsay from the Human Services Research Institute and Laura from the National Association of State Directors on Developmental Disability Services. Lindsay is a research associate and Laura is a director of quality initiatives and supporting families. I would love to turn it over to our speakers today. Thank you so much, and please join me in welcoming them.
Thank you so much, Ryan. We are so excited to be here with you today to share this information that is so important to understand and to act upon for people with intellectual and developmental disabilities. I am Laura Vegas, as Ryan said, part of the partners in the National Coordinators team. We'll talk a little bit more about that later. But I am a female. My pronouns are her and hers. Female, short brown hair. I'm wearing glasses, in my 50s. I have a gold necklace on, and really excited to be here today, and it's an honor. So we'll turn it to Lindsay for her introduction.
Hi, my name is Lindsay DuBois, or DuBois, actually. Go by both. I am a white woman in my 30s. My pronouns are she, her, hers. I have short blondish hair, curly, and I'm wearing a sleeveless dress that's kind of multicolored. And I've got, my background is blurred. I've got some artwork from my children there. So, and with that, we can maybe go to the next slide and jump straight in. So today we're going to be talking through some of the data we have on employment and some actions that can help to enhance employment for people with IDD. But before we jump in, I think it's helpful to back up a little bit and maybe state the obvious about why employment matters. Everyone probably has their own way of answering this question, so I'll share mine. In the biggest sense, we know that nationally, high rates of employment are usually signs that the economy is good. Each month, the government shares data on employment and unemployment, and there are often a lot of news stories that focus on what this means for our country. On a more personal or individual level, lots of adults measure their self-worth and define their success based on their job and whether it's a good one. Having a job is often tied to being active in the community, having friendships, having good health, and of course, having money to pay bills, rent, food, and more. On the next slide, I want to talk a little bit about what US data shows on opportunities for employment. So in September 2024, the rate of unemployment, which is the percent of working age adults who are not working, was 4.1%. That means we have a really high rate of employment. At the same time, there are a lot of open jobs in the US. Currently, there are 7.7 million job openings, but only 7.1 million people who are unemployed who can fill those jobs. So this means that the US has a worker shortage because there are more jobs available than workers who can fill those jobs. This map here shows the worker shortages in each state. And those darker colors mean that there are many more jobs available than workers to fill those jobs. So those states have a higher worker shortage. So for example, South Dakota has just 36 workers available for every 100 open jobs. So what's the point? Well, this means that for people with disabilities, there are a lot of jobs available. And with that in mind, we can look at the employment rates among people with all different types of disabilities on the next slide. Researchers at the University of New Hampshire have been looking at employment for people with and without disabilities since 2008. And this graph shows you the percent of the population that is employed. The yellow line here at the top is the percent of people without disabilities who are employed. And that blue line shows the percent of people with disabilities of all types who are employed. As you can see, in 2021, the percent of people with disabilities working in the US passed 40% for the first time. And that was a great victory, but there's still a pretty big gap in employment for people with and without disabilities, because we see that people without disabilities are typically working at rates around 80%. We also know from data that this gap is tied to wages and earnings from employment. In other words, working people with disabilities earn less money than their peers without disabilities who are working. The last point I'll make on this slide is that we know that during the COVID-19 pandemic, unemployment rates went through the roof and it impacted everyone. But there was also a shift to more remote work, and this may have made it easier for people with disabilities who might have had transportation barriers or lack of accommodations in the past to start finding jobs and participating in the workforce. But we know now that many of those employers have since shifted back to either hybrid or full-time in office. So it'll be important to look at data in the coming years and really see how this is having an impact on disability employment broadly. So at the next slide, I want to talk a little bit about all of the different services and supports that are available to support people with IDD in getting jobs. So every year, states work to provide services and supports specifically for adolescents with IDD who are transitioning from high school to adult services. And there are a number of states that have been working with universities and colleges in their state to create inclusive college programs for students with IDD in a model called Think College. These efforts have been really successful, and they've resulted in almost 5,000 young adults with IDD attending college. We know that having a college degree is a really common requirement for most jobs, and so this is very much connected to improving employment outcomes. We also know that in many of these transition programs, there are young adults who are focused not on going to college, but on getting more experience working in various jobs and getting those job skills. So these states are also working to improve those programs for transition by offering work-based learning experiences in these transition programs. And these experiences are a great way for people to get more hands-on experience, job experience, and can actually help to increase chances for jobs and employment after transition programs. On the next slide, I wanted to share a little bit about some employment supports once people with IDD are ready to find a job. So many people with IDD may need some employment support or job coaching, and sometimes these employment supports can come from provider agencies who deliver long-term services and supports to adults with IDD in the community. In 2022, across the United States, there was more than $1 billion spent on employment supports at these IDD provider agencies. While that number sounds quite large, it actually represents just 10% of all the funding for both employment and adult day services in 2022. We also know that these provider agencies are supporting almost 600,000 people with IDD who are receiving employment and day services, but just over 140,000 of those people are receiving what is known as an integrated employment service, where they're getting more specific employment supports and job coaching. On the next slide, there's another way that adults with IDD who want to work can sometimes get employment supports, And this is through their state's Vocational Rehabilitation Agency, or VR agency. A VR agency provides support to people with various types of disabilities, including people with IDD, to find a job and keep a job. However, VR services are temporary, meaning that they stop at some point after a person becomes employed. To help a person find a job, a VR agency opens a case for that person. And national data that was collected between July of 2022 and June of 2023 shows that VR agencies were able to help 25% of people with ID who had a case opened to obtain a stable job within 1 year of starting services. So that means that 75% of people with ID who had a case open did not find a stable job within 1 year of starting services. The biggest takeaway that I wanted to share from these past couple slides is that it really demonstrates states have a lot of resources that they're using to support people with IDD in going to college and finding employment and maintaining employment. And in just a few minutes, Laura is going to talk a little bit about the employment data we have from NCI that is specifically about people with IDD and whether or not we're seeing some momentum for improving employment. But the last point that I wanted to make is about 14C certificates. And I'm bringing it up because we know it's really connected to the employment outcomes for people with IDD. And I think we get, yep, there, thank you, that's the slide, yes. So many of you have probably heard about 14C certificates. They're certificates that employers apply for to allow them to pay less than minimum wage to workers with disabilities primarily. This is what's called sub-minimum wage. And it was actually legalized back in 1938, and that law has not changed since. And at the time, they thought that this law would actually help make sure people with disabilities would have jobs. We know that it has increased a lot of sheltered workshop participation, and there's been some unintended consequences, I think, is fair to say. And today, it's still relatively common, although it's gotten a lot less common over the years. The recent data that I found for this past year is that the Department of Labor has 714 certificates that they've issued to employers in the United States. And those employers are paying some minimum wages to almost 40,000 workers with disabilities. However, the good news is that 15 states have passed laws that eliminate these certificates. So employers in their states are not allowed to pay people with disabilities sub-minimum wage. So this is an area where there's been a lot of progress, and it's really exciting to see. But of course, it's important when we're thinking about what this means for employment and hours that people can work and their wages. And so we're excited to share a little bit of our data on that. And I will hand it to Laura now. You're muted, Laura.
It's very important, thank you, that we speak to people who use our supports and services, people with intellectual and developmental disabilities, about the outcomes of the services that are provided for them. And so one of the ways that we do that is go out and talk with people is using National Core Indicator surveys, or NCI. Hope you are familiar with NCI, but if you're not, NCI tools collect data on the performance and quality of life indicators directly from the people with a disability and aging and services system. We collect data from families, and we also collect data from direct support professionals, or those who deliver services. For NCI IDD, which is for the people with IDD, we call our flagship survey the in-person survey. And at some point, at least 48 states at some point have participated in the in-person survey. We also have a suite of family surveys that we use to kind of understand the experience and where families are in their lives to support people, their loved ones with IDD. We have a sister survey. We refer to it as NCI-AD. That stands for National Core Indicators for Aging and Physical Disabilities. That's the survey that's used for people primarily who are aging or have physical disabilities. And at this time, at least 26 states have participated in the NCI-AD survey. So you can see that the data that we have is representative of the nation. We pretty much have all the geographical regions covered, and we feel really good about that because we know perspectives are so different from coast to coast and from north to south. Another survey we have, that's one of our newer surveys, although it's 10 years old, but it still feels new, is the State of the Workforce Survey. And that's a survey that is used by states that allows providers to input data into a database around the direct support professionals' wages, the direct support professionals' benefits. We look at turnover rates, we look at vacancy rates. So as you can imagine, in the midst of the ongoing direct support worker crisis, that data has been so valuable both at a state and national level to really advocate on behalf of people who use our services so that we can make sure that staff are paid adequately so they can stay and provide quality services. So 30 states have participated in that survey for the IDD side and 6 states for the NCI-AD side. And NCI was initially developed as a joint partnership between NASDs, which is us, and we are the membership association for all the state DD service delivery systems. So the state DD service delivery systems, and HSRI. So way back in 1997, we were having conversations about the quality of the services and supports that were being provided, and we didn't feel we had a good way to have or standardized measures to really gauge the quality of services and supports across states. So in 1997, the in-person survey was developed and the adult family survey. In 1999, shortly after that, we developed the Family Guardian Survey, and that's for families who have loved ones who do not live with them and receive services outside of the home. In 2000, we developed the NCI IDD Child Family Survey. That's a survey that family members of a person with IDD who is 18 years or younger, I think, or 22, 18, is surveyed to find out about their experience. And in 2013, our sister survey was developed, the NCI for Aging and Physical Disabilities, and that's called the Adult Consumer Survey, or ACS for short. And in 2014, we developed the State of the Workforce. And in 2023, the AD side also developed the State of the Workforce. So we've been around for quite a while. Next slide, please. And have quite a collection of data across many, many years. But the goals of National Core Indicators broadly were to establish a set of recognized performance and outcome indicators for aging and disabilities, including IDD service delivery systems. We use valid and reliable data collection methods and statistical techniques to capture information directly from people who use services, and we do a lot of work around making sure that our results are valid and reliable. A lot of work on the back end in terms of making sure our surveyors are trained, making sure surveyors are shadowed, etc. And we also report individual and state results and national benchmarks of indicators of system level performance. So states can compare across the nation, or they can compare to their neighbor state, for example. Next slide. So a little bit more about the NCI IDD in-person survey. States sample. They conduct this in-person survey by selecting a sample of people, and states design their samples with guidance from HSRI. And final samples are representative of the population that uses services. So it's statistically significant or a sound sampling methodology. And people that could be pulled into the sample are people with IDD that receive at least one service in addition to a case management service. And we do get consent. States have different consent requirements. Some states can allow verbal consent. Some states allow have to have written consent. But our surveyors follow the laws for consent in that state, or the policies for consent in that state. And the important thing is that we make sure that people understand that the information they share with us is is unidentifiable and will not be able to be traced back to them or impact their services in a negative kind of way. Again, surveyor training, all of our surveyors complete the standardized training. In the in-person survey, we use peer surveyors as well. So we have several states that hire people with lived experience to do these NCI in-person surveys. And our survey features, we can either do the survey in person, face-to-face, or remotely. We only allow video at this time. It can't be a phone survey, but it can be a video survey. It includes detailed background information that comes primarily from existing records. So things like a lot of information about health and medical needs and wellness is in our background information. We have the surveys available in multiple languages. And we train our surveyors to understand that questions may be rephrased or reworded to really match the language that's used in that state and to really help people understand the question that we're trying to ask. And so part of our section of our in-person survey does allow for the use of proxy for a subset of questions. Next slide, please. So today we're going to talk about our 21-22 sample. So this is data from our 21-22 from 21 through the 2023 surveys. All in all, we had almost 40,000 people who responded to these surveys. So this data is about 40,000 people with IDD. 36 states participated. You can see those states in the blue in the map. And of those respondents, 60% of those were male. 44% were aged 18 to 34, so we have a younger population. 67% were white, 17% identified as Black, and 11% identified as Latino. And in terms of diagnosis, 86% have a diagnosis of intellectual disability, 29% have a diagnosis of autism, and 7% of the people we surveyed have a diagnosis of Down syndrome. Next slide, please. There's other demographic data that we capture in the survey tool. We look at the residence types, who lives where, and does that have an impact on outcomes and experience of people's lives in our service delivery system. We also look at urbanicity. Do people mostly live in metropolitan or mostly urban areas? And what impact does that have on people's services and supports? We do look at co-occurring mood, anxiety, or psychotic disorders, and 53% of the respondents did identify that they have one of those diagnoses. And half of the people that we interviewed or spoke with have a guardian. Next slide. So just some statistics about employment that we learned from our NCI IDD. 18% of the people that we spoke to, of the 40,000 people that we spoke to, had a paid job in the community. And 45% of the people who did not have a paid job in the community want a job. Going back to Lindsay's point in the earlier slides, where she really laid out the opportunities that there are for people to become employed. And that we saw 40% of people with disabilities working. So people with IDD appear to be working at half the rate of peers with disabilities and a quarter of the rate of people without disabilities. And that's not necessarily because people with IDD don't want to work, as you can see in this graphic. Next slide, please. So the average hourly wage for people working in individual jobs in community-based settings was $11.80 per hour. And the average hours worked over a 2-week period in individual job community-based settings was 28.5 hours over 2 weeks. So most people are working less than part-time and making less than $12 an hour. And it's important to recognize that fact. The differences in wages and hours result in a real cost. In fact, data from the Disability Statistics Compendium suggests that 25% of people with disabilities live in poverty, and that's compared to just 10% of the general population. Lindsay?
Thanks, Laura. So when we talk about employment data from NCI, my perspective is that we also need to really look at the quality of these jobs and not just whether or not people have a paid job in the community. And so we use this definition from the Department of Labor for competitive integrated employment, or CIE. And they define CIE as work that is performed on a full-time or a part-time basis and pays at or above minimum wage, specifically comparable to peers without disabilities. It provides the same level of benefits to employees with disabilities and without disabilities. The work is performed at a location where the employee interacts with others without disabilities, and it presents opportunities for advancement or career growth that is similar to other employees without disabilities. So with NCI data, we're able to look at the pieces here that are bolded. So we can look at whether people are paid minimum wage, above minimum wage, and we can look at the type of setting that they work in. Is it integrated or is it a more segregated environment? So let's start with, on our next slide, the category that we refer to as underemployment. So we define underemployment as people who have a paid job, but they're paid less than minimum wage in their state, and or they work in a setting that is not integrated with people without disabilities. So sometimes this is called like enclave employment. There's different terms that different states use, but we see people that get employed kind of in a small group of folks with disabilities and don't really work with peers without disabilities. So when we look at those who have paid jobs, those 18% of people with IDD who have paid jobs, about 2 out of every 3 are in a setting that we would consider to be underemployed, a job that we would kind of categorize as. On the other hand is competitive integrated employment. So on the next slide, we show some data here. So these are those jobs in which people are earning at least minimum wage and they are working with peers without disabilities. So among that 18% of people with IDD who have a paid job, just 1 in 3 of those jobs meet this definition for competitive integrated employment. The one caveat here that I'll mention is we sometimes are missing data from people's records on their wages. And so we don't necessarily know for everybody who worked if their job meets competitive integrated employment, but we can look at those who we do have that information for. And when we do have that information, this is what we see, that just 1 in 3 people meet that definition. And if we take another step back, we reflect on our whole sample of around 40,000 people with IDD that we interviewed. Those in competitive integrated employment represent just 5% of that whole sample. So in other words, we have a long way to go still when we think about really enhancing the number of people who are in competitive integrated employment. So on the next slide, I wanted to take a closer look at hours and wages and share what we've learned when we look at how these differ for people who are in competitive integrated employment and people who are in a job that we would categorize as underemployment. We see a small difference in the number of hours people work over 2 weeks. So the average for those in underemployment categories is just over 27 hours per 2 weeks, while those in competitive integrated employment is closer to 29 in over 2-week period. So it's really a small difference when we think about 1.5 hours per week, more or less. We also see a difference in hourly wages. So among those who are underemployed, they earn an average of $10.70 per hour, while those in CIE earn an average of $11.94 per hour. And, I know these differences seem small, but they can really add up over several months and years. And there can be a relatively substantial impact then on people's earnings and their ability to live independently as they age. So I want to focus on one thing that we know is pretty connected to having competitive integrated employment. And on the next slide, we've got some data here. And that's whether or not somebody has a goal for employment in their service plan. So it makes a lot of sense that if a provider agency writes down that a person wants a job, that person lets them know, I would like a job. They write it down, that they're more likely to get supports to get that job and then hopefully have the ability to maintain that job, right? So the opposite is also true, that if there isn't a discussion about jobs, there isn't a goal recorded in the service plan, then the provider agency may not be delivering employment supports. So we look at our NCI data here on service plans and employment, and we see that people in competitive integrated employment have goals in their service plan for employment that are at rates twice as high as those who are unemployed, and almost 1.5 times higher than those who are underemployed. So among those who are unemployed and say, I want a job, just 35% have employment as a goal in their service plan. In other words, the majority do not have employment described as a goal in their service plan, but they're telling us that they want to work. Among those who are underemployed, 50% have employment as a goal in their service plan. And then among those who are in competitive integrated employment, nearly 70% have employment as a goal in their service plan. So Laura will talk about this a bit more later on when we're going through some of those solutions and kind of promising practices. But I just want to emphasize how important we think it is that there are conversations with service coordinators and staff each year about employment, so that we can make sure that, you know, people's preferences get incorporated into their service plan. And maybe they don't want to work, and that's okay too. But those types of conversations should be happening and then documented in the service plan. So I'll just finish up the data slides here with a final note about unemployment, underemployment, and CIE for people with Down syndrome and peers with IDD who do not have Down syndrome. So using NCI data, we see that people with Down syndrome are less likely to be unemployed. So among those, if we look at just those who want to work or are working, we see that 37% of those with Down syndrome are unemployed but want to work. And for peers with IDD who do not have Down syndrome, that rate of unemployment is 49%. But we actually see higher rates of underemployment among people with Down syndrome relative to peers with IDD. In this analysis, we found that 44% of those with Down syndrome who work or want to be working are underemployed. And this rate was just 32% of those with IDD without Down syndrome. In other words, while people with Down syndrome have lower rates of unemployment than peers with IDD, they have similar rates of competitive integrated employment. So there ends up being a higher percent of people with Down syndrome relative to peers without Down syndrome that work jobs that are paying them sub-minimum wages or are not integrated in the community. We aren't sure why these numbers are different, but we hope that advocates like yourselves can use this information to help encourage improvements to employment policy and practice for all people with IDD. With that, I'll hand it back to Laura to talk us through some of those promising practices.
Next slide, please. So given all the information that we've shared with you today and the fact that people with intellectual and developmental disabilities want to work and are unemployed largely across the United States, what are some things you can do to impact an increase in employment for people across our system? And some of the things you can do at the individual or the personal or family level is, if you're still in school, make sure that the transition services that you receive begin when you're 14 years old, and that you're talking about employment right off the bat when you start talking about transitioning between school to adulthood. Connect with friends and peers who are employed to learn more about how they got their jobs and how they keep their jobs. Learn so much from your friends and peers, and they always have tips and tricks and secrets for how to make things work that might be otherwise difficult. So connect with those folks who are working and see how that went. Talk to your case manager or service coordinator about employment. Help them understand your hopes and dreams around employment or questions you may have around employment. And when you choose an employment service provider, look for one who has a good rate of success in getting people jobs. Some providers are better than others at being successful in terms of employment placement. We have some resources linked here for preparing for employment. We have one from the Department of Labor that's around securing your financial future toolkit. And we have the NDSS employment resources linked as well. So you'll be able to go to those when you get this PowerPoint. Next slide, please. So at the state level, you can work with your state to make sure they're developing strong transition programs that match students by their interests. And ask your state to share data about Indicator 14, which talks about employment. Most states are proclaimed employment first states. And what that means is that they ensure that employment is one of the first services that people consider when they're looking at services in the home and community-based service delivery system. And states also participate in the National State Employment Leadership Network. So if your state DD agency is not participating in the SELN or has not declared themselves an employment first state, talk to your state leaders about the importance of that. Also, Genevieve from NDSS reminded me that she's there to help you connect with your local legislators and local leaders to really have these conversations. So she's a great resource to help you with that. Also, help your state eliminate the 14C subminimum wage certificates that Lindsay was talking about. It's been a point of controversy for many years. And there are a lot of states that are really just doing away with the possibility of having those certificates in their state. And more, I believe, will go that way in the next few years. Also, work with your state to explore options for people with disabilities to keep their Medicaid benefits, even if they earn more money than is allowed. Some states refer to this as Medicaid buy-in. Other states have different programs that they can introduce you to help you look at wages and help you figure out how to keep your Medicaid benefits and earn a decent living. Next slide. So several states have really sat back and examined how they're providing employment services, and why people seem to be in employment services for years and years and years and don't really get to that securing a job and keeping a job that everybody wants. And so Alabama, Arizona, Maine, and Tennessee, and many, many more, but these are just some that come to mind, decided to change the way that they were providing employment services. And instead of having a broad category called employment that encapsulates all sorts of phases of employment, they've broken down their services based on the phase of employment that the person's in. And some of these states pay based on performance. So providers have X amount of time to do certain activities with the person they're supporting related to employment, and the provider doesn't get paid until that's completed. And so that really helps move along people in the employment journey, and people don't get stuck just always looking for a job for years and years and years and never really getting a job secured. And some states start with a service they call exploration, and that's just going out and seeing what's out there. This is for people who have no idea what job they might want, or who are a little unsure about whether they want to work or not. It's also helpful for families who are a little worried about their loved one becoming employed. And then they break the other employment services down into discovery, and situational and observational assessment. So you can see all these services that are listed on the left-hand side of the screen are steps that are paid for as they're completed on behalf of the person with intellectual developmental disabilities that are aimed specifically for an end goal of having people employed. And states have been pretty successful using this model of supporting people for employment. And compared to the days when they just used a waiver service definition that was a broad employment definition, they've seen great success. So we expect to see more states going in this direction to really increase the opportunities for people with IDD and employment. Next slide. So what can you do at the federal and national level? Talk with your lawmakers. And again, Genevieve is a great resource for you guys to help connect to your lawmakers. Talk about talk to them about increasing the earnings limits allowed for people to be able to keep and be able to keep their disability benefits. That really is a barrier for a lot of people. And I think that earnings limit has not been raised in many, many years. So that's something that is really important for our national lawmakers to take a look at. Talk with your lawmakers about continuing to fund things like the Disability Innovation Fund program. Talk with them about laws and policies that create incentives to employers such as those in the Disability Employment Incentive Act. So there's many things that they can do at the national lawmaking level that would really improve the chances of someone with an intellectual and developmental disability being employed and maintaining employment. Some resources that we have linked there for you are to the Americans with Disabilities Act and the Innovation and Opportunity Act. So those are some federal legislation that has been passed in recent years that is aimed at supporting people to be employed. Next slide. So please stay connected to us. You see our website address there. We are also on Facebook. We have newsletters that you can access by scanning that QR code. We'd love to hear from you. We have the complete data set for all the years that we've collected data for our in-person survey and our family surveys and our state of the workforce survey and the adult consumer survey for AD. So we'd love for you to stay connected. And thanks for the opportunity to speak to you today. I hope you found some of this information useful. And Lindsay, do you want to make any closing remarks?
No, I see we did get a question about slide 35, Laura, which I think was maybe kind of listing those opportunities states have where they're trying to connect better employment outcomes to performance and payment. And I think the question was around who gets paid for completing the services, the job agency, VR staff, the job seeker. I don't know if you would want to comment on that.
So the pay is for the actual service provided, so it would be the service provider. So if you're working with an employment, someone helping you find the job, that service provider would be the one who got paid once they completed the tasks that are required on behalf for that person to help advance them in their employment journey.
Fantastic. Well, again, I hope our audience will join me in thanking Lindsay and Laura for their incredible insights and sharing this information with us today. I think we do still have some time for questions and answers. I know that one question that came up was in regard to, again, just a little bit more about what can we do at the state and federal level to take action and to just appeal to legislators. One of the pieces of information that I wanted to share is that much of the, and as Lindsay and Laura both alluded to and touched on today, is that a lot of the traction around 14C or subminimum wage legislation has been seen at a state level. So with those 15 states having passed legislation, or even states that are sort of coming up with these memorandums of understanding or different plans around how to help the state itself transition away from a 14C certificate or a sheltered workshop or subminimum wage system. You know, that's been incredible. I know I came on board with the National Down Syndrome Society in early 2022, and there were about 1,300 Section 14C certificates that were active and or pending across the country. And now we are sitting at, I believe, below about 800. So that number has nearly been cut in half in just the span of about 2 years. And again, I think that's because of a lot of the traction happening at the state level. So one of the things that the National Down Syndrome Society does and promotes also through our DS Ambassador program, through the Down Syndrome Advocacy Conference, is that appeal to federal legislators that this is happening, right? There is momentum, tremendous amounts of momentum. Lindsay mentioned states that have passed an employment first piece of legislation, essentially stating that that is the first option, right? That's what we're looking to do to help individuals transition out of high school and into post-secondary education or employment, right? We're not looking directly into a sheltered workshop option. So really kind of tearing down those pipelines to sheltered workshops. And so helping folks understand, and again, legislators understand that this is happening at a state level. And so it sort of makes sense, I think, for federal legislators to, you know, essentially, the way I phrase it is be on the right side of history because it's happening. And we would love for them to be supporting and signing on to the Transformation and Competitive Integrated Employment Act, or TCIEA. We have we're closing in the 118th Congress, but hopefully we'll have some more traction in the next congressional cycle. So we'll see how that goes. But again, I'd be remiss if I didn't promote the DS Ambassador Program. Laura mentioned Genevieve Thompson, who is an incredible team member at NDSS. I would encourage you to follow the links and learn more there. And I will say too, this is just an aside, a fun thing is that we are also looking at ways to connect with other ambassador and advocacy type groups from other parts of the United States and other parts of the world. We had a great call with a disability advocacy group out of Brazil a few weeks back. So learning tips and tricks and tools that other countries are using to really leverage some of the storytelling opportunities and to really create systems change within their own systems of government as well.
Yeah, and I would just add to that too. I was going to comment a little bit on the 14C piece as well. So, and there was a question here about successfully transitioning states from 14C to competitive integrated employment. So that Disability Innovation Fund that Laura mentioned, that those funds get earmarked for states to implement grants from the federal government where they can be working on things like the switch to competitive integrated employment. So those are SWITC grants. There's quite a number of states that have SWITC grants where they're working on kind of different demonstration projects to see what might start to kind of catalyze more change. I think the reality is it's not an overnight, and it's not going to be the only solution we should pursue because people might start getting paid at least minimum wage, but if they're still limited in the number of hours they can work, or they don't have job supports, and we're trying to get them to have meaningful jobs, but they're not getting job supports as part of their job. I think that we're still not going to see the results we want to see. I'm always really struck by this data when we look at the number of people who want jobs but don't have them in our data, right? And it's actually more people want jobs but don't have them than have jobs in our data. So to me, that just speaks to the fact that, yes, we should have this top-down approach with 14C and federal legislation, but we also need to have more of a bottom-up approach where we're working with provider organizations, we're working with case management organizations, and we're showing them this data and saying, this isn't great. If all of these people are telling us when we interview them that they want jobs, but they don't have these jobs in their plan, there's obviously not there needs to be more conversation. So I think both methods are necessary to do that bottom up and that top down. And that's just, I wanted to emphasize that as well.
Yeah, and I think too, it gives time, right? So with any of the transformation processes, we're looking at a 5 to 6 year timeline. At least that's how the legislation is spelled out. So there's time for the development of programs and infrastructure. So to your point, Lindsay, it's not just a light switch, right? Where individuals with disabilities are taken out of one setting and immediately dropped into another. We're really hoping to build that infrastructure to help organizations and employers have the pieces that they need, the programs, the support that they need to make this transition possible. I'm sorry, Laura, go ahead.
No, I was just going to say, and speaking to the question about how to get naysayers who think 14C is the only way their loved one will be safe and have employment. One of the good ways to sway people's opinions is with peers or with people with lived experience who actually have jobs and whose family may have been fearful in the beginning or thought 14C was the only way they could be employed. So their stories are very powerful, and families listen to one another. So any success stories you have, I would encourage you to share it broad and wide so people will understand that this really can work. So that's what I was going to add. I was going to say something else, but I just totally lost my train of thought. Oh, I was going to say, we've learned in some of our NCI in-person surveyors for states who hire people with lived experience during surveys to do our surveys, we've had families remark, oh my gosh, you have a job, this is your job, and you're able to do it, and maybe my son or daughter could work then. And so seeing the peer working really inspires families to try and think differently about employment.
Yeah. And I'll just add too that having been a special education instructor only at the high school level here in my home state of North Carolina for a little over 10 years, The conversation starts early, right? We look at transition planning, and as mandated by the Individuals with Disabilities Education Act, that has to start at 16. There has to be a transition plan in place at 16. But we can start as early as we want to, right? As families, as professionals, stakeholders in this line of work. So I would encourage families and individuals to plan as early as possible, and really to holding the team, whether it's the IEP team, the transition team, the individual support plan team. Obviously, there are different sort of milestones and different stakeholders involved in those processes along the way, holding them accountable to the goals and objectives that have been spelled out and that have been identified as true needs and wants of the individual. And I think that's really, the onus is then on us, again, as family members, as professionals, folks who are at that sort of grassroots level, being able to hold the system accountable, and really creating that positive pipeline to employment in the future.
Yeah, the last thing I was just going to add too is when we've looked at the data on like that, we do, and employment outcomes, we do see a connection with where people live, and if they have a guardian. And I know those are some kind of areas that NDSS is also looking at, is alternatives to guardianship. And so I did just want to point that out, because it's not quite as black and white as we probably as researchers love it to be. Like every time we find a result, it just raises more questions about who has better employment outcomes, what are kind of the context that people live in, and the services they receive. So I would just maybe mention that too, since we know that alternatives to guardianship are often connected to having more opportunities for choice and decision making, and ultimately that self-determination piece that is really tied to people's employment outcomes.
Well, as you can see, we have some very passionate professionals on this call. Again, Lindsay, Laura, thank you so much for your insights. The research is it's just an incredible layer and another great tool for us to use in our advocacy efforts. So we will continue our conversations with you all, and of course the National Down Syndrome Society. Looking forward to having Lindsay, you and the team at our Adult Summit. For those of you attending the call today, we will just add a quick reminder that immediately following this webinar, there'll be a short survey. It'll pop up on your screen. We invite you to share your feedback regarding today's event, any suggestions or ideas that you may have for future webinars. Your feedback is incredibly important. We do take that seriously. We review those responses, and it will always help us improve our process and our offerings to the community. We want to thank you again in advance for your feedback. And then finally, I'll just share thank you again for you all joining us on our webinar today. Before we close, I'd like to take another moment to thank Lindsay and Laura for their incredible presentation. If you have further questions or comments, please feel free to reach out to us directly at employment@ndss.org. You'll see there on your screen. And we thank you so much, and we will see you hopefully on our next upcoming webinar.